Okay, so we're going to start part 2 of the nervous system disorders with the functional disorders. So this includes headache, migraine, epilepsy, seizure disorder, Parkinson's disease, Huntington's, Chorea, amyotrophic lateral sclerosis, restless leg syndrome, and transient global amnesia. I love this little cartoon. Not tonight, Wilbur, I have a headache. And that leads us into headaches. Okay, so there are different types of headaches, okay? Bones of the skull and tissues of brain itself do not hurt because they do not have pain. They have sensitive nerve fibers. Now, so the different types of headache. Sinus, the pain is usually behind the forehead and on the cheekbones, and I'm sure most of us, I know I have, experienced this type of headache. A cluster headache, this occurs in cyclical patterns or clusters. It may be caused by abnormalities in the hypothalamus, where the biological clock is located. The pain is in and around the eye. Tension headache, this is due to muscle contraction, and the pain is like a band squeezing the head. A migraine, this refers to a syndrome of vascular spasms of the cranial blood vessels, causes a change in cerebral blood flow, and you can have pain, nausea, and visual changes are typical of the classic form. Epilepsy or seizure disorder. This is a chronic brain disorder, condition of the brain manifested by seizures that occur more or less regularly throughout a person's lifetime. Seizures are interruptions of normal brain activity. To function normally, the brain's messages need to be sent from place to place in an orderly manner. A seizure is, in effect, many parts of the brain firing at once. The order is lost and brain cannot carry out its normal functions. It's characterized by sudden episodes of abnormal, intense electrical activity, results in seizure activity. So we have a partial or generalized seizure. A partial seizure is a localized area of brain that is affected. They have amnesia of the attack, which means they don't remember it, and there's no loss of consciousness. In a generalized seizure, there's a diffuse electrical abnormality. You can have an absent seizure, or it's also called a petit mal, where there's a brief change in level of consciousness. There's a loss of awareness of surroundings. It lasts a few seconds and occur many times during the day if not treated. The other type is the tonic-clonic or grand mal seizures. They fall on the ground. They have a loss of consciousness. The tonic part is a prolonged contraction of the muscles. The clonic is when the muscles relax, and they may be incontinent of urine and feces. Now, there's a condition called status epilepticus. This occurs when one seizure follows another with no recovery of consciousness between attacks. And the first aid for seizures, of course, cushion the head, loosen tight clothing, turn on their side, time the seizure, don't put anything in their mouth, look for an ID to see if they that you know they have a seizure disorders, don't hold them down, and when it ends, offer help. Okay? Now, don't panic. Let me come on my own. I need medical attention if I'm visibly injured or the seizure lasts for more than 3 minutes. So when to call 911. So if they don't have an epilepsy or seizure disorder ID, there's a slow recovery, a secondary seizure, or difficulty breathing afterwards, or if they're pregnant or have another medical identification bracelet. Parkinson's disease. This is a slowly progressive deterioration of motor nerves in the brainstem. Characteristics are pill-rolling tremors, muscular rigidity, slowness of movement, and postural instability. It's caused by a loss of neurons in the brain called the substantia nigra. Normally, these neurons produce the neurotransmitter dopamine, which helps direct muscle movement. When neurons become damaged, dopamine production stops and the body loses full movement control. Okay, there's the dopamine. So it's, you notice how there's not enough dopamine coming in? Okay. The most effective drug is levodopa, which allows the neurons to make new dopamine. Huntington's chorea. This autosomal dominant, so everyone who has the gene will develop the disease. This is a progressive degenerative disease that causes certain nerve cells in the brain to waste away. As a result, the patient can experience uncontrolled movements, which is the chorea, emotional disturbances, and mental deterioration. A common observation is that the earlier the symptoms appear, the faster the disease progresses. In 2006, researchers discovered that the protein expressed by the Huntington's gene interacts with another protein to disturb the way cholesterol accumulates in the brain. Cholesterol is essential for healthy brain cells and the network among these brain cells, but the cholesterol needs to be in proper levels and in the proper locations. When the network of brain cells is disrupted, motor skills, cognitive skills, and speech can be affected. Amyotrophic lateral sclerosis, or ALS, it's also called Lou Gehrig's disease. Progressive, ultimately fatal disease that damages the motor neurons and the brain. The brain can no longer direct the muscles of the body. Restless leg syndrome. This is irresistible urge to move the legs or body part due to an uncomfortable or odd sensation. Transient global amnesia. This is a sudden temporary episode of memory loss that can't be attributed to a more common neurological problem. The inability to retain new information and to recall past events during a period of minutes or hours. It's 1 to 6 hours and maybe as long as 12 hours. Encompasses entire memory of current events. Patients know who they are and recognize people they know well. They don't know where they are or how they got there. Can't remember what happened a day, week, or even a year ago. Some causes are sudden immersion in cold or hot water, strenuous physical activity, sexual intercourse, medical procedures such as angiography or endoscopy, acute emotional distress, bad news, conflicts, or being overworked. Next, we're going to talk about peripheral nerve disorders. We're going to talk about peripheral nephritis or neuropathy, trigeminal neuralgia, also called tic douloureux, or Bell's palsy. So peripheral neuropathy, it's also known as neuritis. Degeneration of the peripheral nerves affects the distal muscles of the extremities. Peripheral nerves come out of the spinal cord and arranged along lines in the body called dermatomes. And that's what these guys are. Peripheral neuropathy occurs when nerves are damaged or destroyed and can't send messages from the brain and spinal cord to muscles, skin, and other parts of the body. When damage occurs, numbness and pain in these areas may occur. Now, you can have a mononeuropathy, and this is damage to a single peripheral nerve. An example of that is carpal tunnel syndrome. Or polyneuropathy, where many peripheral nerves throughout the body malfunction at the same time, and an example of this is diabetic neuropathy. Trigeminal neuralgia, this is also known as tic douloureux. Pain in the area innervated by the trigeminal nerve or the fifth cranial nerve. So this trigeminal nerve branches out. There's 3 branches. One is the ophthalmic branch, and you have pain in the eye and forehead. The maxillary branch causes pain in the nose, upper lip, and cheek, and the mandibular branch causes pain in the lower lips, outer portion of the tongue, and area of the cheek close to the ear. Bell's palsy, this is a disorder of the seventh cranial nerve, which is the facial nerve. It causes a sudden onset of weakness or paralysis of the facial muscle. So, smoothing of the forehead, so your forehead crinkles when you either think about something or could be an emotion. The inability to close the eyelid and the eyeball, cause the eyeball to roll up. They have drooping of the mouth with the drooling. Okay, and there's that facial nerve. And we have infectious diseases such as meningitis, encephalitis, Guillain-Barré syndrome, and poliomyelitis. Okay, so these are the ventricles of the brain, and in the ventricles is where ventricles are where you find the spinal fluid, cerebral spinal fluid. Okay. This is meningitis, inflammation of the meninges caused by bacteria or viruses. The primary organisms are Neisseria meningitidis and Streptococcus pneumonia. And remember that subarachnoid space contains the spinal fluid. So stiff neck, headache, fever, vomiting, light sensitivity, drowsiness or confusion, joint pain, and fitting, having a fit. This is Nuchal Rigiditis. This is seen in acute bacterial meningitis. The patient is unable to flex their head forward due to an unnatural rigidity of the neck muscles. It's associated with irritation of the meninges. Encephalitis. This is an inflammation of the brain tissue caused by an infection, and it's usually a virus. Viral encephalitis may develop during or after an infection with any of the several viral illnesses, including herpes simplex, measles, mumps, rubella, rabies, chickenpox, and arbovirus infection. Now, an arbovirus is arthropod-borne, and those are mosquitoes and ticks. And HSV1 is the more common and serious cause of viral encephalitis. Guillain-Barré syndrome. This is an acute, rapidly progressing disease of the spinal nerves. It causes demyelination of the nerves, can sometimes follow a respiratory or GI infection in 10 to 21 days. This is a neurologic disorder in which the body's immune system attacks part of the peripheral nervous system. Immune system starts to destroy the myelin sheath that surrounds the axons of many nerve cells, and sometimes the axons themselves. When this occurs, the nerves cannot send signals efficiently, the muscles lose their ability to respond to the commands of the brain, and the brain receives fewer sensory signals from the rest of the body. The result is an inability to feel heat, pain, and other sensations. Poliomyelitis. This is a highly infectious viral infection caused by the poliovirus, causes selective destruction of the motor neurons. It affects the anterior horn cells of the gray matter of the spinal cord. And the last slide is, this is the anterior horn cells of the gray matter in the spinal cord. Okay. This is the dorsal horn, the dorsal root ganglion, the lateral horn. Okay. All right. I just want to show you where that was. And that's it.